Good morning, everyone. I am pleased to welcome you all today. Thank you for joining this session. Today, we will be discussing an important topic in pharmaceutical analysis: calculation for antibiotic assay. This is a crucial method used to determine the potency of antibiotics in various formulations. Over the course of this presentation, I will guide you through the fundamental concepts, the step-by-step calculation procedures, and some practical examples. So, without further ado, let's get started and explore this essential aspect of antibiotic testing. Now, let's explore why the microbiological method is used in antibiotic testing. Some antibiotics cannot be accurately measured using chemical methods alone. Instead, these methods focus on the biological activity of the drug, which is crucial because it reflects how effective the antibiotic will actually be in fighting infections. This approach ensures that the antibiotic is not just present in the right chemical concentration, but is also capable of exerting its therapeutic effect. The core principle behind this method is that antibiotics inhibit microbial growth. The more effective the antibiotic, the greater the inhibition. And importantly, the degree of inhibition is directly proportional to the concentration of the antibiotic present. This means that by measuring how much microbial growth is suppressed, we can determine the biological potency of the antibiotic. The microbiological or micro method is used specifically to assess this biological activity. It measures how well an antibiotic can inhibit the growth of a sensitive microorganism, giving us a clear picture of its effectiveness. To clarify, an antibiotic is a chemical substance produced by microorganisms, or their synthetic or semi-synthetic derivatives, that kills bacteria or inhibits their growth. These drugs are essential in treating and preventing bacterial infections. In essence, antibiotics are medicines that fight bacterial infections by either destroying bacteria or stopping their multiplication. This is why understanding their biological activity through microbiological methods is so important in ensuring we provide effective treatments. Let's talk about the cup plate method, which is a fundamental technique in antibiotic assay calculation. This method helps us determine the effectiveness of antibiotics by measuring zones of inhibition around a sample. Essentially, we place a cup or well in an agar plate, add our antibiotic solution, and then observe how well it inhibits bacterial growth. The key here is to accurately measure the zone of inhibition, which indicates the antibiotic's potency. When performing the assay, it's crucial to ensure consistent sample volumes and proper incubation conditions to get reliable results. Calculating the antibiotic activity involves comparing the zone sizes against standard reference values, which helps us quantify the potency of the antibiotic sample. This method connects to the overall theme of quality control in antimicrobial testing, ensuring that our antibiotics meet the required standards before they reach patients. So, understanding the cup plate method and how to perform the calculations correctly is vital for accurate assessment of antibiotic efficacy. It's a straightforward yet powerful tool in microbiological assays. Let's take a closer look at antibiotic assay calculation. This slide is all about understanding how we determine the potency of an antibiotic sample through calculations. The key points here include how we use standard curves and sample readings to find the concentration. It's important to grasp that accurate calculations are essential for ensuring the efficacy and safety of antibiotics. As we connect this to the overall theme, remember that precise assay calculations underpin quality control in pharmaceutical production. This process helps us verify that the antibiotics meet the required standards before they reach patients. So, mastering these calculations is fundamental to our work in maintaining medication integrity. Let's take a closer look at amikacin sulfate as defined by the Indian Pharmacopoeia 2018. When we talk about its composition, we see that the molar ratio of amikacin to sulfuric acid can vary. In one case, it's 1:2, and in another, it's 1:8. This ratio is important because it influences the amount of active drug present. For the 1:2 ratio, the amikacin content ranges from a minimum of 674 micrograms to a maximum of 786 micrograms per milligram of the dried substance. Similarly, for the 1:8 ratio, it's slightly higher, from 691 micrograms up to 806 micrograms per milligram. The key takeaway here is that these values give us a quantitative measure of the active component, C22H43N5013, in the drug. This is calculated on a dried basis, ensuring consistency across different samples. Now, to verify the potency, we perform an assay, specifically, a microbiological assay of antibiotics using method B, as described in section 2.2.10. This method allows us to determine the actual amount of amikacin present by measuring its biological activity, expressed in micrograms per milligram. Finally, the slide mentions the turbidimetric method for the antibiotic assay calculation. This technique measures the cloudiness or turbidity of a solution, which correlates to the concentration of the antibiotic. It's a reliable way to quantify the active ingredient, ensuring the drug meets its specified potency. Throughout this process, understanding these ratios and assay methods helps us ensure the quality and efficacy of amikacin sulfate in our pharmaceutical preparations. Now, let's talk about how to prepare our standard solutions for the calibration curve. First, we need to prepare 5 different concentrations by diluting our stock solution of the antibiotic. The key here is to do this stepwise, increasing each concentration in a ratio of 5:4. This systematic approach helps us generate a reliable and accurate standard curve. The median concentration among these 5 standards is particularly important because it serves as the reference point for our analysis. Once we've identified that median concentration, we then dilute the solution of the substance we're examining, which is the unknown sample, to match this concentration as closely as possible. This method ensures that our measurements are within the most sensitive and accurate range of our assay. Remember, the goal here is to establish a solid relationship between concentration and response, which will ultimately allow us to determine the amount of antibiotic in our unknown sample with confidence. This step is crucial because it underpins the accuracy of our entire antibiotic assay calculation. Let's take a closer look at antibiotic assay calculation. This is a crucial step in determining the potency of our antibiotic samples. Essentially, we need to accurately calculate the activity based on our test results. It involves comparing the zone of inhibition or other measurable responses to a standard curve or reference value. The key points here are understanding how to set up the calculation correctly, ensuring all measurements are precise, and recognizing how these calculations relate to the overall effectiveness of the antibiotic. Remember, accurate calculations not only validate our results, but also help us compare different samples reliably. Throughout this process, it's important to connect these calculations back to our goal of assessing antibiotic potency, which ultimately guides us in quality control and ensuring efficacy. So, mastering this calculation step is fundamental to producing trustworthy and meaningful data in our antibiotic testing. Let's go through the procedure step by step. First, you'll place 1 milliliter of each concentration of the standard solution and the sample solution into separate tubes, making sure to do this in duplicate or triplicate for accuracy. Then, to each of these tubes, add 9 milliliters of nutrient medium that has already been seeded with the appropriate test organism, and shake them vigorously to ensure proper mixing. At the same time, it's important to prepare 3 control tubes. One should contain the inoculated culture medium itself, which serves as a culture control. The second control is identical, but treated immediately with 0.5 milliliters of dilute formaldehyde solution. This is our blank. The third control contains uninoculated culture medium, acting as the uninoculated control. Once everything is prepared, place all the tubes into an incubator or water bath, maintaining the temperature specified for about 3 to 4 hours. After incubation, add 0.5 milliliters of dilute formaldehyde solution to each tube and shake vigorously again to stop any further growth. Finally, measure the growth of the test organism by determining the absorbance at 530 nanometers, comparing it against the blank to get accurate readings. This process helps us assess the effectiveness of the antibiotic, and the absorbance readings are critical for the subsequent calculation of the antibiotic activity. Let's take a closer look at antibiotic assay calculation. This is a crucial step in determining the potency of our antibiotic samples. Essentially, we're calculating how much antibiotic activity is present based on our assay results. Key points include understanding the relationship between the concentration of the antibiotic and the observed response, often measured as zones of inhibition or similar indicators. We need to accurately measure these responses and then apply the appropriate mathematical formulas to find the concentration or activity level. It's important to remember that these calculations help us compare different samples and ensure consistency and quality. Connecting this to our overall theme, the assay calculation is fundamental in validating the effectiveness of our antibiotics before they reach the market. So, mastering this calculation ensures reliability and confidence in our results. Welcome to Slide 10, where we focus on antibiotic assay calculation. In this part of the presentation, I want to emphasize how crucial accurate calculations are in determining the potency of antibiotics. We'll explore the key steps involved in performing these assays, starting with preparing the test solutions and standards. Remember, precision at this stage directly impacts the reliability of your results. Next, we'll look at how to interpret the data, often involving the use of standard curves and regression equations. These tools help us quantify the antibiotic concentration in our samples. I want to highlight that understanding these calculations ensures consistency and accuracy across different assays and laboratories. Finally, connecting this to our overall theme, proper antibiotic assay calculations are essential for quality control, ensuring that medications meet safety and efficacy standards. So, mastering this process is fundamental for anyone involved in pharmaceutical analysis or microbiology. Let's now take a closer look at antibiotic assay calculation. This part of the process is crucial because it helps us determine the potency of the antibiotic sample. Essentially, we compare the sample's activity to a standard, which gives us a way to quantify how effective the antibiotic is. The calculation involves measuring zones of inhibition, or sometimes actual concentration, depending on the method used. By doing this, we can ensure the antibiotic meets the required standards and is safe for use. Remember, accurate calculations are key to maintaining quality control in pharmaceutical development. This ties back to our overall goal of ensuring efficacy and safety in antibiotic production. Let's take a closer look at antibiotic assay calculation. This is a crucial step because it allows us to determine the potency of our antibiotic sample accurately. Essentially, we're comparing the activity of our sample against a standard to see how effective it is. The calculation involves measuring zones of inhibition or other activity indicators, then applying the appropriate formula to find the concentration or activity units. Remember, accuracy in these calculations is vital because it directly impacts the reliability of our results. By mastering this, we ensure our antibiotic assessments are both precise and meaningful, tying back to our overall goal of quality control and effective antimicrobial development. If you need any further support, please don't hesitate to reach out to us. We're here to help and ensure you have everything you need. Thank you so much for your time and attention today. Remember, we're always available to assist you on this journey. Thank you again, and have a great day.